My name is Paul Frater. I work for the clinical education team in Lothian and also as an intensive care nurse in the Royal Infirmary. So I'm going to show you the emergency tracheostomy laryngectomy box, which should accompany all patients when they're in any clinical area. So the box itself, this isn't an exact replica of the box. The box is actually bigger than this one here. We're going to go through the contents and show you what should be contained. There's a contents list with all the boxes, so it's a case of just looking through it every time you come on shift to check you have all the emergency equipment you need. So there is a head torch, which actually we don't have here, but the head torch should be in the box as well. Suction catheters, size 14, which is here. A stitch cutter, sterile scissors, there we are. A neonatal face mask. Now that's for particularly laryngectomy patients who, if there's an emergency airway situation, will be ventilated with a ambu bag through their stoma. So that's why that's there.
Is the flange soft? Or is it?
Yes, so they can actually be inflated with a syringe, so they're a little bit firmer. Okay. You get a better seal over the laryngectomy site. Okay, so tracheal dilators as well. Some lubricant gel. Should have 2 of those in each box, and a 10ml syringe. So that is the contents of the emergency box. These can be found in all ICUs across Lothian. So if the patient comes in through A&E, somebody can phone up to ITU and get one of these boxes. The other thing I want to talk about is the accompanying paperwork that should accompany each patient with a tracheostomy. Any patient with a tracheostomy or laryngectomy should have one of these, the appropriate airway management algorithm. So this should be up on the wall at the patient's bed space. Also, they should be filled in when the tracheostomy or laryngectomy was performed and the size of the tracheostomy. In emergency, call 222 for help, and it gives directions to the responder, whether it be the nurse or the doctor, as to what to do. But we will go through this a bit more in detail later. The other thing is the more detailed emergency tracheostomy laryngectomy algorithm, which is, as I say, is a more detailed version of the 2 I've just shown you. This can go up on the wall as well, or can sit next to the patient's bed space. In addition to the contents of the emergency box, we should also have at the patient's bed space another tracheostomy that's the same size as the one the patient has, and also one that is one size smaller. So you should always have 2 spare tracheostomies with the patient's emergency box.